2020, and with increasing understanding of the nature and behavior of coronavirus, the government has continued to strengthen measures to protect lives and also livelihoods to mitigate the impact of this disease. There are many measures we have been taking, and all of them bear emphasis, particularly the non-pharmaceutical interventions and the public health measures that have been well advertised. Now, a very important one is this vaccination, about which a lot has been said today. It is very important to have this gathering. First, to appreciate the donation that has come to our country by way of the United States government, and also the effort of the government to make its own acquisition from the AVAC tax team. And secondly, to let all Nigerians know that these vaccines are safe and they have been tried and tested. We have not lost anybody to it in Nigeria. There are people who have had small complaints, but none of them has been fatal. And then to urge everybody to participate, we are looking for at least 70%. And the way things look, because we observe what goes on in other countries, it will probably need more than 70% of our citizens to give us herd immunity. There are countries today which are still suffering despite a large percentage of vaccinations. Those who have had 60% are still having very high cases, and their health systems have been overwhelmed. Our health systems are still standing up, and even though we have been commended for the response so far, it is dangerous for us to rest on our oars. We need to continue to work together. It is not the work of government alone. All of you, all Nigerians are involved. And particularly all of you who are here in the media, who send out the messages to tell the citizens that it is a job for everybody. Nobody is exempted from it. Wear your mask, observe social distancing, know that we are fighting a very dangerous disease that changes its forms, the mutation that gives us concern. Right now we are dealing with the Delta variant, and those of you who are watching the news, international news, will have seen the havoc that it did in India and in other countries. We do not want to get in that situation, and that's why this vaccination is extremely important for everybody to take seriously. It has been tested, and the NPHCDA has prepared very well to deliver it. As has been said, some vaccines are reserved for hard-to-reach areas, security-compromised areas, and also itinerant workers and nomadic people who will not get the second chance for a second vaccine. So the plans are very intricate and very well laid out. All we need now is the appeal to all citizens to work with us, to continue with the non-pharmaceutical interventions and make sure that we get to where we are going at a little cost of loss of lives or loss of livelihood. And that will be all I need to say. And to also here introduce and present this COVID-19 vaccination in Nigeria field guide that will be prepared for health workers and for the delivery of these vaccines to Nigerians in the most effective way. As has already been indicated, Nigeria is also working on being a production site for vaccines. We are working with eminent Nigerians, and we have been working also with National Assembly to get the resources, and it will also require technology transfer and a considerable investment from countries with whom we are already in touch. And so with that, I would like to invite all those who are participating in this launch. The Executive Director, distinguished senators, SGF,